Assalamu alaikum. This is Dr.OBT live. And today our topic is thread lift. So there are two different kinds of threads. There are threads which lift, and there are threads which do not lift but induce collagen formation once we leave them under the skin. Both are minimally invasive techniques, and they can be performed in an office setting, obviously with appropriate sterilization. Good candidate for thread lifts is someone who's got a heavy jowl or a very heavy lower face and has exhausted all the non-invasive options such as HIFU or radiofrequency microneedling or radiofrequency and ultrasound skin tightening treatments. So if those are not working for you and your degree of laxity is more, you're a good candidate for thread lift. And thread lifts last anywhere between 1 to 2 years. It depends on the thread, the quality of thread and what it's made of, because there are threads which last much shorter than others. Like PDO threads can last between 6 months to 10 months maximum. PCL threads can last up to 2 years. So it's good to find your aesthetic practitioner who is experienced in those kind of threads, the ones they like to do more of, and see their results before you make any kind of such decisions to use threads. The other threads which induce collagen formation, they can be used anywhere. You can use them in the cheeks to treat scarring. You could use them under your chin to tighten your skin for skin laxity under your chin. You could also use them in the lower face, and you can even use them in the upper and outer face. So the goal is that we leave in that thread, it cannot lift, we just pull out that base of it, and over time that induces collagen formation, and that any place where we are inducing collagen formation is always going to look better, because the more collagen we have, the more firmer and healthier our skin is. Thank you. A threaded procedure means that we're going to use a bit of numbing cream prior to the treatment, and I also use some injectable numbing agents, and it should be performed in easily under 15 minutes. Generally it's PDO or PCL, and both are biodegradable. PCL degrades over a much longer period of time, up to 2 years. PDO are much shorter. So threads, if sometimes our skin feels that there's it's a foreign body after all, so it can react. So sometimes you can have early complications or side effects. I would not say complication, would be a bit of puckering or dimpling, which should settle in the first week or 2 weeks. If not, there's a very easy method to detach that attachment to the skin. But I always make sure that before my patient gets up after my thread lift, I do the appropriate maneuvers to not allow the skin to be puckered or tethered to the thread. The other a complication of thread lifts can be like a foreign body granuloma, which means it's like a little bump, the body kind of creates this little encapsulation around the material, and that can cause a bit of a lump. And with antibiotics, it should settle. If not, we need to do a minor surgical procedure. But it's very rare. And if you take care of all the precautions such as aseptic technique and be safe, it should not occur. But if it occurs, it's something which can be managed. Generally speaking, not really, because you've put in the thread. The short-acting threads, the ones I was saying, which induce collagen, they don't need to be reversed because they're just there and they're doing their work. The ones which are lifting, generally cannot reverse them because they're going to break down anyway. So we should just attempt to do some intervention only when there is an infection or some problem with the thread. Other than that, you should just let it go, and over time it will degrade and it should be fine. In a lot of my facelift patients I've encountered the thread. So I mean, in some cases it's in odd locations, and sometimes it can be, it can actually cause a bit of issues while I'm doing my facelift. So And then when I asked the patients, they're like, they had it done about 2 years ago. So in some cases, your material can last longer, and it can be there. Not that it's doing anything. I mean, the patients had no complaints with the thread, but if it's something, if you're at that stage where you might actually be a good candidate for surgery, then it's a good idea to actually just allow the surgeon, to whoever you choose, to let him know that I had a thread lift, so that when he does the facelift, a proper facelift, he can actually remove those threads and do a proper surgical facelift, because nothing will last longer than a good well-executed deep plane facelift, which is a personal favorite of mine, in which we are actually doing whatever we're trying to do with a thread lift, but in a very structural and very anatomical manner, trying to redrape the skin, but also reduce the any kind of laxity and any kind of deflation, and also any kind of descent of the soft tissues. So obviously you have to actually understand that when we exhaust all the non-surgical methods, then surgery is the ideal path to take. Thank you. For thread lifts, the aftercare is a prescribed dose of antibiotics, and in about 4 to 5 days maximum time, the swelling should reduce.